Greetings to you all from JSSH Hospital on this occasion of World Health Day. We are all well aware that World Health Organization has declared 2017 theme as depression. Let us talk. This has a very significant meaning. We are all aware that each one of us sometime or other have experienced this feeling of sadness or depression. This could be just a manifestation of some underlying problem to a major psychiatric disorder. This is one of the very, very common disorder, and we are all aware that by 2020, when we are talking about morbidity and mortality, this will be the second most common disorder in the whole world. Compared to the world, the Indian population being so high, the number of people who are likely to go through this problem will also be extremely high. This is one of the extremely common problem for people who have attempted and committed suicide, to almost majority of the departments where people present with multiple aches and pains and so many other forms of presentation, except talking about sadness. This sadness is a very, very common condition, and when you are trying to talk about an illness, all the surveys in India have shown that almost 10 to 20 per thousand suffer from this serious form of illness, and about 100 to 150 per thousand from the milder form of the illness. That tells us about the mind-boggling number of people who are going through this problem. Unfortunately, neither patient recognizes nor their relatives, so also the even medical people sometimes miss out this particular issue. In addition, people have the wrong idea that it is a psychiatric problem, because of which, in fact, they have to manage themselves rather than get treatment. This whole idea has to change. And this is an illness which can be caused by so many reasons. There are some biological factors, psychological and social factors, and it can affect almost all age groups. Children are known to go through this problem. Middle age, extremely common, so also the old people. In case of children, the child passing urine in the night, which has controlled its milestone, to refusing to go to school, to the old age people not getting sleep, to multiple aches and pains what they complain, could be related to this particular problem. Important point is actually, even somebody talks about suicide or suicidal ideas, it should be immediately brought to the attention of professionals, for the simple reason that this particular individual's life can be saved. As we told, there are multiple causes, so also multiple types of treatments available. In fact, recognizing early, properly taking the professional help can bring about remarkable changes. And one of the advice for the people is that when you have any such feelings, do talk to your relatives. Family members could be an immense help in managing this type of problems. The doctors use medicines. There are a range of counseling technologies available, so also the physical and other forms of treatment. One should make use of it to get out of that. Nowadays we talk about very commonly the form of suicide and lot many other such things. And suicide in adolescents and young individuals is actually growing significantly. These are all the problems can be managed extremely well if recognized early and timely help is provided. This is also known that the gender matters, and among women this is 2 to 3 times more common. So both males and females, young children to old, and each and every one of us are in the queue in a way to tell that we are possibly develop depression. Recognizing early and treating should be the message we would like to give on this particular occasion. We all wish you a healthy year, and if there is any problem, seek positively the professional help, and that too early, that way problems can be avoided. Wish you all the best.